how does age affect a woman's ability to have children?
So a woman is born as a young girl with all the potential eggs that she is going to have through her reproductive life from the moment that she's born, and that doesn't change. However, as she goes through the stages of puberty and then through the reproductive years, the numbers begin to diminish.
Okay.
Particularly from the age of 35 to 40, there is a significant decrease in the quality of eggs that are produced every month.
All right. So what can a woman do, or can she seek help too young? And what age can she start seeing?
Well,
Doctor?
There are some conditions that young women have that can affect their fertility in later years. It's really important to recognize that. And they may well already know that they have something like polycystic ovary syndrome, which is troublesome in the way of weight gain or...
It's very common as well these days, I think.
It is endemic, which means it is super common in young women, and it's complicated by weight gain, and characterized by changes in complexion, but also hair quality, and very frequently menstrual pattern irregularity. So very infrequent periods will tell us that they're not ovulating, and that means fertility is...
The very infrequent.
Very infrequent.
Yes. All right. What can you tell us about the services and the treatment options provided by AMNM?
Okay, so we have a very different model of care here. First of all, as the name suggests, we're in partnership with Northwestern, which is one of the top 10 US hospital providers. So that means that every case that I have, I discuss with my consultant colleagues in Chicago.
Okay.
So we reference ourselves to and benchmark ourselves to the best in the US in the local context. So that means we can bring all that expertise to the care of patients here in Qatar.
Great, absolutely great. What specific tests would you recommend to diagnose fertility?
So we need to do tests for the man and for the woman. We need a sperm sample from the man,
okay,
so that we can look at the numbers of sperm, how active they are, how normally formed they are. And we need to check with the woman her ovarian reserve blood test, which is called AMH, and that allows us to understand how sensitive she would be to treatments that we can offer in fertility. It doesn't tell us about the quality of the eggs.
I was going to ask you about, does it tell you about the quality?
It doesn't.
So what should be done?
The age is the best guide to potential quality.
Okay.
Or response to previous treatments that they've had with IVF, where we gain a great deal of knowledge from the way that they have responded to treatment, or the way that their embryos have grown, which are the new babies that are only a day old, or 3 days old, or 5 days old, where we can examine them very closely to see how they've progressed and learn a lot from that journey.
All right. One question is, how many times should one try IUI, which is the intrauterine insemination, before actually moving on to the IVF, in vitro fertilization?
You know, there are several options for fertility treatment. Simple help with just helping ovulation to occur.
Okay.
It could be tablets or it could be injections. And then IUI.
Depending on the body, or depending on the case of the person?
It depends
or both?
on the case of the person, and it's a personal choice as well.
Okay.
It's much less invasive and can be safely monitored with the help of a provider. And we do that here.
Right.
We also do intrauterine insemination, which involves very gently stimulating eggs to be produced one at a time, as well as cleaning, washing and preparing a sperm sample which is gently inseminated at the right time of the cycle for fertility. And that has a lower success rate, but is very acceptable and very well tolerated. So it does mean that more tries are needed, and at least 3 is proposed to.
At least 3.
If they're not successful, it may be that they choose to do another 3 or move on to IVF.
Should we always do IUI before IVF, or sometimes we just go straight to IVF?
Well, we would always advocate that IUI be considered.
Okay.
It often becomes very clear at an early stage when we have the results from sperm tests or blood results for the woman, that neither simple ovulation induction or IUI is really a sensible or safe option.
Okay, great. Thank you so much for the information. Thank you for watching this episode. If you have any concerns about your fertility, you can take an appointment at AlFardan Medical with Northwestern Medicine to see Dr. Guy Fender.